I'm trying to first become less nervous so I can think and
We
then
can
I
do
can
that.
start.
We're not going to lie about when we recorded it.
Yeah.
Are we?
Should I go into history?
Answer it from your heart. We're going to have lots of nerds on this in the audience as well. So,
Okay. So you can cut out bits of it if you feel they're boring.
hi Radhika, and welcome to The Curious Case of with me. Thank you so much for being on the show and for coming in talking to us. Radhika is, amongst many other things, a psychologist, and I don't like to only call my guest the one thing. So she's many other things also. I know that you and I have talked about mental health lots of times over many long texts and also in person. And we've talked about things like from advocacy to the education and training process for professionals, caregivers, and all the mayhem that they go through. And I know that we've always talked about how we would like to be able to disseminate helpful and useful information in a way that is accessible to people in words that they can understand, so it's less overwhelming. And so that's why today I sort of wanted to start at the very basic, because there's mental health and then there's mental illness. But I feel like now on social media and stuff, it all comes under one hashtag. And it's all being talked about as in a clubbed manner in our attempt to spread awareness. So let's set some parameters. I know that this is a very difficult question to answer, and there will be many buts and disclaimers that will come into your mind. Both of us struggle with the absolute truth and worrying that if we say a sentence, people will not make room for the gray.
Yeah.
So if you had to explain to a 5-year-old the difference between distress and a disorder, what would you say?
I think thresholds for pain are different for different people. So categorizing something as distress is a very personal thing. What I find is distressing me may not distress you. Any kind of pain that I have, I need to figure out if this pain is something that needs to be addressed because there is a deeper issue involved, or if this is something benign. Nevertheless, I need to know what it is and address it. So pain itself, any form of pain, I think is a warning sign for us to address an issue. Mm-hmm. When a person feels that I'm having a difficult time managing this by myself, they still have now room and access to go to someone to talk about the issue. So distress can come at certain points in your life and go away and not come again. Whereas when something lingers and it comes or it interferes with your functioning for a longer period of time, so if I'm not able to live my quality of life, I'm not able to go to work, I'm not able to focus on things, and this is going on for more than a couple of, let's say, days or weeks, then it's, I think, something that needs to be addressed by going to a doctor. So a lot of times it has happened that clients come to me saying that the doctors say that I don't have any issue, but then I still have pain. And one of the reasons that we speak a lot about validation in psychotherapy is it's not that we are making you very comfortable with everything that's going on in your life, because that's not really productive. But by validation, what we mean is we are not doubting or second guessing the fact that you are in pain. So there are these lines at which I think there is some line, and that line keeps changing. So it's a constant questioning of, well, at what point is this becoming extreme? At what point is this actually maladaptive? So I think rather than giving the labels of normal and abnormal, I prefer adaptive and maladaptive. Because in the one case, it's helping me to deal with something and I'm adapting to the situation. Another case, no, it's actually causing me more, it's derailing me from my quality of life and daily living. So I think adaptive and maladaptive is a better label or better
Articulation.
Yeah, it's a better articulation.
Like you said, everybody goes through distress, and everybody's and it's subjective, so you cannot say one experience should be only this distressing to everybody who's experiencing it. And I also feel like it's very important to say that just because it's distress and not disorder doesn't mean it's any less painful. The reason I'm having this conversation or asking this question is so that someone listening can be like, where am I at?
Yeah.
As someone who is confused, who's in that gray, what is therapy?
Usually when people have come to us, it depends on the pathway through which they've come to us. So some of the pathways include being referred by somebody else. So let's say a neurologist or a neurosurgeon refers a client to us because they say that, you're having headaches, but we've realized that these headaches are not neurological, and perhaps you're stressed. You should go and check out if that's the case. So one of the things that psychologists can do is assessments. We are trained, of course, there are issues with assessments, which is a whole technical bit. But what preliminary assessments do is at least they help us realize that, okay, there seems to be an issue which could be something that needs addressing. If a client is referred to us where people say that, they've started behaving very differently from what they otherwise behave. So there is data points that families have. So sometimes they come to us to say, is it just normal part of lifespan development? So it could be that if an adolescent is coming to us with a lot of irritability, a parent is going through their own issues at work, financially, or if, in my case, let's say my child is an adolescent and I'm going through perimenopause. So both of us are going through this at the same time. And I have low frustration tolerance. He's having his own issues, so the clashes tend to be more. So this is not necessarily even falling under the category of distress, but it's just that I need a third party, an objective person to come in and perhaps help mediate the situation in a way in which we both can go through this together and come out of it better. So it's not always that there has to be a diagnosable issue or there has to be distress. Perhaps the distress is just that something is happening right now that is different from before. So this is one category. Another category of people who come is people who have, some life event has happened and they have really adapted to most life events, but these things have accumulated, what we call as basically continuously things have happened over the last, let's say, 6 months. And they say that this allostatic load is what we call it, where there is one stressor and then another and then another. And so we can handle the 1, 2, and 3. But the straw that breaks the camel's back then says, okay, now I can't handle this. This is getting too much. Then they come to us saying, I've had clients who've said that we are rational people. So we don't know why we are coming to you. Because the idea is they feel that only if you're irrational do problems occur. So in those cases, we say, well, it's not necessary that you don't have to be rational for you to come to us, right? It could just be that you need a sounding board. It could be that you need to go to a place which is safe, where there is some amount of catharsis. So you're just, you need support, and that support is objective. You don't want to go and speak about the same things to your family, let's say. So there are a lot of people who come to us for supportive therapies. There are a lot of people who come to us for short-term therapies. They say, there's a problem which is very time-bound, and we just need to speak to somebody so that we can hear ourselves think. And that also helps sometimes to speak to a person, to hear your own thoughts out aloud. In this case, I've had people specifically asking me to not be directive. They say, we don't want a therapist who's directive. We want somebody who just is a very good listener and perhaps chimes in once in a while, because we gain our own insights through this short-term process. So there is also that. There's another kind of person where they come to us for curiosity. So I've had people come for just a session saying that we just want to know what is therapy, which is great, because I think in the past, the stigma part of it was a big deal. We have a long way to go, but I think it's reduced a great deal. So there is also the curiosity sometimes. Then there are the more serious cases that come. Then there are people who come to us who've been referred, let's say, by psychiatrists who say that there's a problem with the family, educating the family about what the issue is, what they can expect in terms of prognosis, what they can expect in terms of support. Family members wanting to understand what's going on. One problem that we see, I think, or that I have seen a lot in my career, is individuals who truly believe that marriage is a solution to mental health issues. So if a person has, let's say, a psychotic break, I've had family members saying ki iski shaadi karwa do so that it'll fix the problem. And then the marriage happens, and then they come to us, not the family that the person has grown up in, but the other family, let's say the partner, the spouse. They come to us saying that after marriage, this issue has occurred and we don't know what the problem is. And so they come to us saying that we only want you to give us a certificate so that we can go to court, So there is that also. So there can be use and misuse and abuse of the system, of course, rather than coming to us for the person's well-being per se. So, so there's that aspect as well.
So when I Googled the definition of therapy, it said treatment intended to relieve or heal. I think in my experience, different people have very different ideas of what therapy is supposed to do for them. And that also then impacts the therapeutic process, because if I'm stepping in with a certain expectation and that expectation is not being met, then I feel like therapy doesn't work. So for someone who's either in a gray area, confused, not sure whether they need it or not, or someone who's in a lot of pain, or a caregiver, because actually the answer for all three of them will be the same. What happens in therapy? What can I expect? And what should I not expect?
So since you're coming to therapy, and what is therapy and what are the ingredients that go into therapy, I want to go back in time a bit. So in cultures, there has been this process of meaning making, and that has been there for ages. Now, in some cases, the meaning making has been brutal. There has been perversions of, be it in Western or Eastern, I'm not looking at where specifically, but generally, irrespective of culture, they have had ways of dealing with problems, and some have been ritualistic, some have been spiritual. So it's been around for aeons, right?
Some examples would be removing nazar.
Yes.
Would be a healing practice.
Yes. Also, if you look at religious practices, you also have, for example, going for confession.
Yeah.
So
that's like a kind of catharsis.
Yes, catharsis. There were some festivals or healing festivals where there is possession, for instance. So, so it varies. Healing traditions have been, like I said, they're all over the world.
Yeah.
What happened with the West is that around the time of, let's say, the 17th, 18th centuries, you had Newtonian physics, you had Darwinian biology, where suddenly there were explanations given for physical phenomena that could be replicated, that could be seen, and where you could have meaning making that was different from just guesswork. Then you had, of course, the Darwinian biology, where suddenly biological phenomena could be given. You could see that there were certain reasons why certain things happened. And then the scientific method became sort of the gold standard for going through things. Apart from your Newtonian and your Darwinian revolutions, we already had certain hypotheses or meaning making where, for example, you had Anton Mesmer, who said that there is some kind of an invisible force that exists in our body, and this invisible force can be manipulated. And so mesmerism comes from him. Of course, later on it was proven as a pseudoscience, right? But at some point, when Sigmund Freud came in and spoke, he basically researched and he wrote a lot extensively, he wrote about talk therapy. And this is the point at which suddenly, and also Freud himself he came from the medical profession.
Yeah.
So suddenly you saw that meaning making could happen and could be taken through a scientific framework and be called as, let's say, therapy. So when you look at the frameworks when you look at psychotherapy per se, it went through a lot of churning where they looked at stuff that was unstructured. They took it through science and frameworks. They studied it. And then what Sigmund Freud did was he brought some sense of or some semblance of structure and frameworks to the process of catharsis or to the process of what is not seen. So the internal processes that are happening which cannot be seen with your eyes, he brought that into the realm of science. Mm-hmm. And of course, we now see Sigmund Freud more as literature than as... And psychoanalysis has also progressed a lot from Freud. Post-Freud, you had a lot of behaviorists who came and said, well, we don't know what Freud was doing in therapy because what you see is what you get. So we need to do things, or we need to quantify things and then and then say that this is because of something that's happening internally. So whether you look at Ivan Pavlov, because he's my favorite, or you look at Watson, or you look at all of the other behaviorists that came afterwards.
Ivan Pavlov is the dog with the bell and the food, guys.
So, yes, so when you look at the behaviorists, they say, well, we want to be able to use certain methods like conditioning, for example, so that we know that there is a cause and effect. Then you have all of the behavioral techniques that came in around that time. Post the behaviorists, what started happening was you had a lot of humanistic existentialists who came into the picture. There was World War II. Post the behaviorists, you had people who tried to make meaning of the war. And so you had the humanistic existentialists, where a lot of questions were asked about the meaning of life, the meaning of existence, a higher purpose for being. And so then those therapies started coming into, so there are what we call as waves of therapies. You have the first wave, you have the second wave, now you have the third wave therapies. So when you're looking at what are the ingredients of therapy, the third wave therapies, which is basically your cognitive behavior therapies, you have your humanistic existential therapies and so on. Of course, now you have your mindfulness and acceptance-based therapies, and there are many more that have been added. So in therapy, there are so many different kinds of therapies. There are so many different ingredients that go into therapy, but there are certain, I think, lowest common factors. One of them is that when you go to a therapist, you should feel safe. That's very important. Second is what we call as therapeutic alliance. There should be a rapport that you have with your therapist. You should feel that they are emotionally resonating with you. I've had people say, I got creeped out. Okay, then don't. Walk out. It could be that the person is very good on paper, but when you go into your first session and you feel that this is not working, then you should pay heed to that. Does not matter what the qualifications of the person is or who's recommended that person to you. Advocacy is something that it's not very strong in India. But this is why clients should also learn to advocate for themselves, to say, what is the meaning of this? To ask questions. I do think accessibility and affordability are two very important parts of therapy. A lot of people say that I tried it online because the person was not accessible in person. And this is especially post-COVID, right? And they say, I really like the therapist, but I feel like I want to meet them in person and they're not open to that. Well, then really you have to consider perhaps to look for a different therapist and see if that works better with you, even though this therapist is good and you felt comfortable there. The therapist also has to be non-judgmental. One thing that people don't really speak about, and I think it's really important, is I personally, I have been a patient myself, right? And I don't like therapists who are patronizing, holier than thou, or saying, I know better than you, because there's a power equation involved. When a client is coming in, if I feel I always know better than you, then it's a problem. As a patient myself, when I've gone into a therapist's cabin and I have not told them that I'm a therapist, for instance, and they have spoken down to me, that I know so much better than you and just listen to me without asking any questions, it really infuriates me. I think that's not okay.
I think the idea that therapy is a little intangible is something that scares people or makes them slightly uncomfortable and unsure, especially because if you're in distress or you're in any kind of pain, what you're looking for is certainty. And there's lack of understanding about therapy. That therapy went through a journey. The practice of therapy has bit by bit incorporated the various learnings that us as a civilization have had. I know that you worry about generalizations, and so you pointed out that there are flaws. Even as we try and create these frameworks, there are flaws. While there are flaws and while there should be a healthy amount of skepticism and questions, ask your questions, I think it's important to let people know that we have found ways that can be very helpful, and that there is hope, and that we've come a long way. And so that if you're struggling, yes, you might come across unhelpful therapists, and you might come across doctors who may misguide you. But that's the world that we live in, and that happens in every profession. But I think it's also important to say that it works.
There is no doubt that it works. And I think as a scientist practitioner, it is my job to constantly keep questioning myself, because that's how I will evolve. It's really important to not sit back and say, well, I'm comfortable because now we know the solutions to these problems. I see a therapist. The only reason I do that is because I know that it works. There are times when it has not worked in my family. In some certain cases, it has not worked. And we have continued to look for a different therapist to see if perhaps it's the therapist. Perhaps there's a therapist variable.
So people can trust therapy. Therapy is helpful and useful, and it's not just pseudoscience. For the most part, the caveat or the disclaimer is, let's try and understand how it's helpful so that we can, or what makes it helpful, so that we can find the right kind of help, so that we can make informed decisions to ensure that we get the best out of it.
I think that's absolutely correct. But because I said that, I feel that the road to hell is paved with good intentions. So it should not be that it's just a therapist who has good intentions. It has to be more than just good intentions. It has to be someone who's really good at their craft.
Yeah. So, yeah, of course, you please, do your therapist shopping and find someone that you're genuinely comfortable with. But a lot of people sometimes have asked me, how do you know whether it's a good fit or not? And my usual answer is, give it a couple of sessions and then sort of listen to yourself. One of the things that I wanted to address is that people feel like, oh my God, I have to go and talk to this complete stranger about everything in my life. And how can I trust them? And I think that's another misconception of therapy, that in your first session, you have to go there and divulge your whole life. Whereas it's not like that. You go into your first session, you say as much as you feel like saying. And then if you do feel comfortable, you'll end up saying as much as you feel like.
I think that's really important to note, actually. So many times it's not been until the third or fourth session with a person that we have gotten into it. To set for them what to expect is something that is a responsibility of the therapist, not the client. So the idea is that I should be able to make you feel comfortable when you come in. This is not an examination. When I speak about the power equation, therapists who are self-aware, who are very aware of the fact that there is already this imbalance in power, simply because they are sitting in this position where the other person is seeking help, they need to neutralize that in some ways. And really good therapists, you will know, are good at that because they make you feel extremely comfortable within the first maybe 10, 15 minutes of coming in.
Mm-hmm.
Yeah.
Because people talk about agency and people talk about there is a power dynamic, and I feel like there's no point in trying to pretend that it's not there, and there's no point in trying to get rid of it because you can't get rid of it. If I'm in pain and you're helping me, automatically there is a power dynamic, and I'm coming to you because I'm in pain and you can help me.
There's another thing that clients have told me when you speak about this. They say, we are in pain, but you made us wait outside for half an hour. And there were 15 other people sitting there. And we were staring at each other thinking, who's crazy? So we were judging each other. So the stigma is not just this way, it's also the other way. Even though I may be myself diagnosed with something, I'm also, judging others. So there are clients who have that insight. And I think it is also up to therapists in some ways to deal with that. Now, I had the luxury of, spacing out my clients such that nobody sees the other person. Some therapists don't have that luxury. And now with therapy going online, there is that safety aspect that people feel, I don't have to be seen in public and I don't want to be seen, because there is still that inhibition. What if I bump into someone I know? What if in the building somebody over there talks to my whatever? What if I've not told anybody that I'm coming? I think these are all very valid points, because also given the cultural aspects in India, I may be going for therapy and let's say my parents don't know about it and they find out. And then suddenly now in the house, I'm living with them and they are constantly bombarding me with questions saying, are we not good enough? Can't you come and tell us what your problems are? Why are you going to a third person and why are you wasting so much money? So,
The one that I really wanted, when I discovered the answer, was a really helpful revelation for me, is what is the difference between a friend and a therapist? Like, why can't I just go talk to my friend? Or your friends or your family feel like, why can't you just come talk to me? And I think that the biggest thing for me was that if I come and talk to a friend or I come and talk to family, I have to calculate whether you're going to judge me for this sentence or not. Versus with a therapist, it's all about you, and it's only about you, and it will always only be about you. And this is not a social relationship that you need to sustain.
Absolutely. I mean, my friends don't come to me, even though I'm a therapist. And I can't be a therapist to my friends. So it works the other way around as well, because I think when there is a certain structure and there is a structured situation which you're coming to, in my case, because I practice, let's say, cognitive behavioral therapies, I am also formulating and I'm also creating my own data points for you. So I'm giving much more in terms of my attention and energy in listening to you, and I come in there with a certain kind of training. Now, if I am that structured in my friendships, then what tends to happen is I'll be exhausted at the end of the day, first of all. Secondly, that's going to permeate into all of the other decisions I take in our interpersonal relationship. I might say, oh, well, I'm having this issue, but I know that other person's also suffering right now, so I can't do this. And then there's a lot of complications that come in. Of course, you have friends and family to vent out to, and that's why they're friends and family. But sometimes an issue requires a more structured approach, A. B, sometimes there are some things that you don't want to share with them because you're very private. I mean, I find that it can be really hard to be honest to yourself about things. And I don't want to be judged if, for example, let's say I cry and I feel comfortable to cry in a situation where I'm with my therapist, and then I can go out and, go about my day. And it's not that I don't do that with friends, but with friends, the expectations are different. With family, the expectations are different. Perhaps all I want from them is a hug. I don't hug my therapist. So there are boundaries that are different when it comes to therapy and friends.
There are times when I want to cry or throw a tantrum, and, Popeye worries about me sometimes because I have episodes of my depression. And there are times when I'm going through a rough patch and it's sustained. And then there are times when I just want to be weak for the moment. But he doesn't know which is which. So he might get worried about it when he doesn't really need to. And so with a therapist, you don't really have those expectations. You can just do and be without necessarily worrying about how it's going to emotionally impact them and what effect it's going to have on their life.
It's time bound also, right? So the awkwardness is that, let's say my time's up and suddenly I'm in the middle of like this crying session, and 10 minutes in, the therapist says, you have 10 minutes. And that's happened to me while I've gone to a therapist. So I realize how awkward it can be for the client as well. That doesn't happen with friends, right? I can go there and I'm staying there the whole night. Then I'm just coming back the next morning. So there is that aspect. And there is a different kind of comfort you have in both situations, I feel. So I also have to, as a client, then figure out what I'm going to do with that hour. And so one of the things that I realized when I went for therapy, for instance, is I then started actually sitting and reflecting on what it is that I want to do there. And that wouldn't happen unless I know that I have to go there now. What am I going to discuss? And
I have only this much time to
I
talk
have only
about
this much time. So I'm actually helping myself to gather my thoughts together versus with a friend where I don't have to do that. The second thing is that I think when you say lying in therapy, a lot of times, let's say I'm not necessarily doing it consciously. A lot of times, sometimes when I speak to my therapist, I'm creating this idealistic image of me. That is
Want
not
to
me.
be best patient, want to be good patient.
So it's not even for the therapist.
It's for yourself.
I'm listening to myself. So it could be that I'm talking about this idealized version of me and this villainized version of, let's say, as an example, my parent. And then after that, I come back feeling like, why did I do that? That itself has its own, so in therapy, we deal with that as well. And I come back in the next session and say, I don't know why I said that or did that. It's not really so starkly that, I am a hero and they are the villain. And I think I did that. And then I bring that with me wherever I go, because it generalizes to other situations as well, where I feel like perhaps I'm taking this to an extreme. Maybe it's not as bad as I think. So these insights come in, which necessarily don't come in when I'm with friends.
Yeah.
And I think that insight is really important.
Yeah, because you don't necessarily get the time and space to think about how you're behaving when it comes to your social friendships, because they're so fluid and so continuous, versus where in a therapy session, you would notice how you behave, or the therapist would point out how you would behave. And that's another reason why I think it's so important to set expectations, because to realize that it's not a social relationship. We're not supposed to get coffee. And if your therapist doesn't want to get coffee with you, they're not being mean. If they're ending your session on time, they're not being mean. They don't not want to talk to you. The purpose of this 50 minutes is different from the purpose of a conversation with your friend. So one of my questions was, what does it mean to do therapy? One of the big parts of therapy is to validate the person's experience, but you're not doing it to cushion them or to baby them. You're doing it because they need support in this difficult situation. But then what is the responsibility of the patient or client to put in the work?
Validation does not mean I agree with everything that you're saying and that I empathize with you in a way in which it makes you feel that the way that you behaved, for instance, is okay simply because you're in therapy. And it could be that the way you behaved was not very nice. When you say validation in therapy, or you have that safe space, it means basically that you're disinhibited in a manner in which you're able to be honest to yourself. And you're in a situation where you're not going to be judged, right? But nevertheless, the goals of therapy are, I think, that you're able to have more clarity about what's going on in your life. There could be certain issues that for some reason you're not able to put your finger on what's the problem. And when you come in for therapy, a therapist who has an objective perspective is able to tell you certain patterns and is able to say the fact that this is repeating over and over again perhaps could mean that it's not external situations, but it's something about the way you think about this problem that's causing you to behave in a certain way. So I think when that happens and when there is insight, now insight can also be of two kinds, right? You can have intellectual insight and not emotional insight. So in Marathi we say karta hai pan varat nahi hai, which means that I get it, but then it's not trickling down into my actual behavior. I'm able to understand, but I'm not able to act on it. So the idea is that in therapy, at some point, there is that shift from it just simply being an intellectual insight to becoming an emotional insight. And when does that happen? A lot of time it happens outside the therapy situation. It happens when you go back and the thing happens again that you were talking about, but we've discussed it in therapy, and I've asked you to, I've kind of said, okay, now put the spotlight on that and just observe. And you've become suddenly an observer. And the emotional insight is that aha moment where, oh dear, it is happening. And then you don't really have to try to change. That's a work in progress. It takes time. Because if you're fixed in your patterns, then it takes a certain amount of time for that pattern to change. So you have to be, so the therapist will also help you to be kind to yourself, saying, hey, now you have the insight. You're going to have to change over time. You can't it's not going to happen overnight.
But then the idea is that slowly you work towards changing that if you feel like that is a maladaptive pattern. So in terms of my responsibility as a patient within the therapy, would you say it's the willingness to look and form insight, and then the willingness to patiently, in a kind manner, work on the things that together with your therapist you decide are maladaptive, or things that you want to work on?
The clients who've come to me who I think therapy has worked best with, well, it's a collaborative process. That's why we call it a therapeutic alliance. We are allies. I think it's curiosity. The single most important thing, as far as I'm concerned, is when a client comes in with curiosity and openness. Because when you're curious, then we are both exploring, because we don't know what's going to come up. We may find something that we were not looking for. And now what are we going to do with this? Do we need to really look at it? Or do we need to say, okay, here's a new specimen, and okay, it's not really important right now in this context, and move on? So I think when there is that curiosity and then there is that openness, then a lot more can be done in our work together. So of course, therapy is about, we use models that are generalized, but we are dealing with a client, and that client is like no other.
Yeah.
Their fingerprint is unique. And it's really important to recognize that and to make you feel that you are different in that sense, and special in that sense. And when I say validation, I mean that kind of validation. I don't want to box you into a category in that way.
What I recently learned to articulate is that what it means to be an adult is that now you have to take care of yourself. And I think that in the interest of that, how can you actually psychoeducate yourself to be able to give yourself most amount of agency in this scenario?
I could speak about young children because I have a young child. I think it depends. There is an over-dependence on short form and an under-dependence on long form. And certainly I have learned a lot from books. And a lot of good self-help books exist over there, written by people who have studied this as a science, but who are able to write for lay people. And I think one should seek that information, read those books, and come up with questions. Now, just because you've read a book, you don't have to agree with everything that the book says. It's not set in stone. So there needs to be that flexibility to understand that this applies to me and this doesn't. Art forms. I mean, there are times when people have come to us saying, I saw this in a movie, I saw this in a play, I saw this artwork, and I realized that this existentialist artwork, I realized because of some, let's say, Instagram reel, told me that this artwork actually is, signaling of the age of anxiety. And then I went and read up more on that. So there are so many different artistic ways also to come to a question. And there are insights that people have when listening to a friend or to somebody else speak about their issues. People speaking about problems in, and you overhear them speaking about that problem. I had people say, I overheard that. And so I felt like, okay, maybe this is an issue with me. So I think once you are freed from the shackles of feeling that you're tied down to your destiny and it's all pre-written, and it's all set out for you, and then there's no decision that you can take that can change that. Once you're free from that, you realize that, there could be that I could feel, and this is something that someone told me actually, which stayed with me. I have a choice, Radhika, between the devil and the deep sea, but at least I still have a choice. And I that really stayed with me. I said, wow, okay. So when they realize that I still have a choice, they say, then I can still make that choice. I still have that agency to make that choice. So I choose this over that. And perhaps there's a choice that I don't know exists. So I'm coming to you for therapy to understand if do I feel I'm stuck in a way that is so, because I'm stuck, I feel there is no future and I can't go back and change the past. Can you help me get unstuck? And I just don't want to feel stuck. So this is good enough. I mean, and so with therapists, we can help to sometimes come to you and get you to realize you have more freedom than you think you do.
There is one tangent that I wanted to just touch upon before we end, is that in the beginning we talked about distress versus disorder, and that there is a difference when it comes to disorder. I often wonder how that can be explained to a person who hasn't been through a disorder.
One of the thought experiments that I've had that I do with people is I say, okay, how would you explain the taste of salt to somebody without using the word like? It tastes like this. So explain to somebody that taste of salt. And you can't say saltiness. You can't say it tastes like this or like that or like that. How are you going to describe that taste? And I think that oftentimes, at least with my family members, it's helped saying, oh.
Yeah, I'm trying to do it right now and I'm not being able to.
I said, so it's only when you say it's salty when you've tasted it, right? And you're saying, oh God, I like it or I don't like it, or it's too much or it's too less or whatever. And then how do you quantify that saltiness? Like some people say, well, this tastes good with it, this tastes bad with it. So, I take them through that and I say that, well, that's how this is. It's difficult for me to explain because I have nothing else to compare it to. And I don't know if what I'm feeling is what that person is feeling. But I'm trying to use language to bridge that barrier, and language fails me.
That's an amazing thought experiment. I am forever going to use that now.
It really works.
Yeah. Okay. Thank you so much. At the end of every episode, I like to do a little thing. At Agatsu, we are proponents of something called emotional hygiene, and one of the aspects of emotional hygiene is sort of paying attention to the little things. What I mean is basically that if you get from point A to point B without any traffic, it's unlikely that you'll tell someone. But if you get to point A and from point A to point B with a lot of traffic, you will tell someone. And I think the idea is that we end up giving more attention to things that don't work out, and it's fine. They bother you. Go ahead, give them attention, but don't forget to give attention to the things that go well, or that go normally, or that go interestingly. So we're going to get some clipboards, and the idea is that you write down something today, only in the span of today, that went okay or good, that you would like to focus on, or just give a moment to. I'm a little stuck on today's one because all I've done is woken up. Oh, I remember. How can I forget?
What's the spelling of surreptitiously?
My God. You have to explain the word, okay? You're such a nerd, Rohini. Yeah?
Yeah.
Mine is that I had coffee with my mom this morning, and she said, "No, don't go, stay longer." And it made me feel really special.
Oh, that's... You were with your mom this morning?
Yeah.
Oh, well, I hope she's doing well. Today, Justin picked flowers for me, Jasmine, and he surreptitiously left them on my reading desk so that when I woke up and I sat to study, I could smell them. I knew that he had kept them there. Now I'm expecting it tomorrow.
Thank you for watching The Curious Case Off with me. In the description below, there will be links, further reading, summaries, guidelines, resources, everything that we could find and put together that we think you might find helpful. Just to reiterate that everything that is said in the episode as well as in the resources below should not be used to self-diagnose. If you have any questions or queries, please reach out to a mental health professional who is qualified. And if you like the episode, then like, share, and subscribe to Agatsu Foundation, our YouTube channel. And if you want to know anything more about the organization, then you can find out at www.agatsufoundation.org.